One of the most telling signs that an elderly person may be in their final year is the appearance of irregular breathing patterns and noticeable changes in skin or circulation. These symptoms occur because the body is slowly shutting down, and vital organs are no longer functioning at full capacity. Breathing becomes less efficient, and blood circulation weakens, leading to visible and sometimes alarming physical changes. Families may observe episodes of labored or shallow breathing, with pauses in between breaths. This is often referred to as Cheyne-Stokes breathing, where breathing alternates between deep, heavy breaths and periods of no breathing at all. Such patterns may appear during rest or sleep and can cause concern, though they are usually not painful for the person experiencing them. Shortness of breath, wheezing, or frequent sighing may also become common, reflecting the lungs' reduced ability to deliver oxygen. Alongside changes in breathing, the skin often shows signs of poor circulation. Hands, feet, or legs may become cool to the touch or take on a bluish or purplish tint. This is due to the heart's reduced ability to pump blood effectively to the extremities. In some cases, mottling, patchy, uneven skin coloring appears, especially in the legs and feet. These changes are clear physical signals that the body is redirecting blood flow to vital organs as it prepares for its final stages. While these signs can be distressing for families to witness, it is important to recognize that they are a natural part of the body's slowing process. For the elderly person, these changes are typically not painful, though they may cause discomfort such as shortness of breath or a sense of restlessness. At this stage, supportive care becomes essential. Techniques like elevating the head, using oxygen therapy, or providing a calm, quiet environment can ease breathing difficulties. Keeping the room cool and ensuring the person is not overly bundled in blankets can also help with circulation-related discomfort. Emotionally, these physical changes often serve as a stark reminder that time is limited. For families, it can be a deeply emotional moment to realize the body is preparing for life's final transition. Instead of focusing solely on the physical decline, this stage can be an opportunity to provide reassurance, gentle touch, and loving presence. Ultimately, irregular breathing and visible changes in skin or circulation are not just medical symptoms but clear markers of the body's final journey. Recognizing them allows families to shift their focus toward comfort, dignity, and creating meaningful, peaceful moments during the closing chapter of their loved one's life. Cognitive decline, confusion, and memory lapses are often subtle but significant signs that an elderly person may be in their final year of life. While occasional forgetfulness is a normal part of aging, this stage involves a deeper, more persistent decline in mental clarity. Families may notice that their loved one has trouble remembering names, recognizing familiar places, or following simple conversations. They may seem disoriented about time, asking repeatedly what day it is, or even become confused about whether it is morning or night. This mental decline is often tied to changes in the brain and reduced blood flow caused by aging or chronic illness. Conditions such as Alzheimer's disease, dementia, stroke, or Parkinson's disease can accelerate memory loss and confusion. However, even elderly individuals without a formal diagnosis may experience this decline as the body weakens. A lack of proper nutrition, dehydration, infections, or side effects of medications can also worsen confusion and disorientation. One of the most distressing symptoms for families is when the elderly person begins experiencing episodes of delirium, sudden, fluctuating periods of severe confusion. They may see things that aren't there, become agitated, or fail to recognize close relatives. At other times, they may appear calm but disconnected, staring off or withdrawing from conversation. These fluctuations can be emotionally draining for both the individual and their caregivers. Cognitive decline also affects daily functioning. Simple tasks like managing finances, cooking, or even dressing may become overwhelming. Some individuals lose the ability to follow step-by-step instructions or forget the purpose of everyday objects. As this worsens, they often become increasingly dependent on others for safety and care. For families, patience and understanding are critical during this stage. Instead of correcting every mistake or trying to force memory recall, it is more comforting to provide reassurance, gentle reminders, and a calm environment. Simple communication, using short sentences and maintaining eye contact, can help reduce frustration. Creating routines and surrounding the person with familiar objects or photos may also ease disorientation. Ultimately, cognitive decline is a reflection of the brain and body slowing down as life nears its end. Though painful to witness, it is an opportunity for families to offer compassion, patience, and unconditional love. Rather than focusing solely on what is being lost, cherishing moments of connection, whether through a smile, a touch, or a shared memory, can bring peace and meaning during this final chapter of life. Frequent hospital visits and recurring health complications are another strong signal that an elderly person may be in their final year of life. As the body weakens with age, its ability to fight infections, recover from illness, and manage chronic conditions diminishes significantly. This often leads to a cycle of repeated medical crises, such as infections, breathing difficulties, or worsening of chronic diseases, that require frequent emergency visits, hospital admissions, or continuous medical attention. Families may notice that hospital stays become longer, and recovery times shorter. For example, a simple chest infection or urinary tract infection, which might have been treatable at home years earlier, can now result in a serious hospitalization. Heart failure flare-ups, strokes, kidney problems, and uncontrolled diabetes are also common complications that keep reappearing. Instead of regaining full strength after treatment, the elderly person may return home weaker each time, with less energy and resilience than before. This cycle is often described as a downward spiral. Each complication chips away at the body's reserve, leaving the person more vulnerable to the next health setback. Hospital environments themselves can also add to the strain, with unfamiliar surroundings, disrupted sleep, and invasive procedures causing confusion, stress, and disorientation, especially for those with dementia or frailty. Emotionally, frequent hospital visits can be exhausting for both the individual and their family. Elderly patients may feel frustrated, fearful, or even hopeless about their repeated illnesses. Families, on the other hand, may struggle with constant worry, emergency calls, and the difficult decisions about whether aggressive treatments are truly helping or merely prolonging suffering. At this stage, it becomes important to consider whether the focus of care should shift from curative treatment to comfort-based or palliative care. The goal is not to give up on the person but to reduce unnecessary hospitalizations and ensure they spend more time in the comfort of their home, surrounded by loved ones, rather than in sterile medical settings. Hospice services, home care, and supportive therapies can often provide better quality of life than repeated hospital trips. Ultimately, frequent hospital visits and recurring complications are the body's way of signaling that it is no longer able to recover as it once did. Recognizing this sign gives families the opportunity to rethink priorities, shifting from constant medical intervention toward comfort, dignity, and meaningful time together during the final stages of life. A decline in mobility and the growing difficulty of performing daily tasks are strong indicators that an elderly person may be in their final year of life. Mobility refers not just to walking, but also to balance, coordination, and the ability to perform even simple actions such as standing up, moving between rooms, or climbing a few steps. As strength and endurance fade, once routine activities can become exhausting or even impossible without help. Families often notice early signs such as increased reliance on walking aids, shuffling steps, or frequent pauses when moving. Over time, even basic tasks like bathing, dressing, eating, or using the bathroom may require assistance. This loss of independence can be one of the most difficult changes for an elderly person to accept, as it directly affects their dignity and sense of self. The decline in mobility usually stems from a combination of factors. Muscle wasting, sarcopenia, joint stiffness from arthritis, balance issues, and chronic conditions like heart disease or neurological disorders all play a role. Reduced nutrition and low physical activity accelerate weakness, while fatigue and pain further discourage movement. Falls or fear of falling can worsen this situation, as seniors may avoid walking altogether, which in turn speeds up muscle loss. Emotionally, this stage often brings frustration, embarrassment, or sadness. For someone who has lived independently for decades, depending on others for simple tasks can feel like a loss of identity. Families may also struggle, feeling torn between wanting to help and wanting to respect their loved one's independence. Supporting a person through this decline requires patience and adaptation. Practical solutions like installing grab bars, using mobility aids, or rearranging living spaces for safety can help reduce risks. Encouraging gentle physical activity, such as short walks or stretching when possible, may preserve some mobility. However, the focus should shift from maintaining independence at all costs to ensuring comfort, safety, and dignity. Declining mobility is more than just a physical issue, it is a sign that the body is conserving energy and prioritizing survival over activity. Recognizing this allows families to adjust their expectations, provide the right level of assistance, and focus on meaningful interactions rather than physical achievements. Ultimately, this change signals that the individual's world is becoming smaller and more limited, not by choice but by necessity. Families can respond with compassion by offering support, creating a safe environment, and cherishing the shared moments that remain, whether through conversation, touch, or simply being present. Another subtle but meaningful sign that an elderly person may be in their final year of life is a noticeable withdrawal from social interactions. This withdrawal is not always intentional, it is often the result of the body and mind conserving energy as life begins to slow down. A person who once loved family gatherings, phone calls, or friendly visits may gradually lose interest, preferring solitude or quiet rest over interaction. This change can be confusing or even hurtful to loved ones, who may interpret it as rejection. However, it is important to understand that social withdrawal is typically part of the natural transition near the end of life. For many seniors, engaging in conversations or keeping up with social routines becomes mentally and physically exhausting. Even listening, responding, or remembering details may feel overwhelming. Fatigue, cognitive decline, hearing difficulties, and emotional changes like depression or anxiety can all contribute to this withdrawal. In some cases, elderly individuals may also begin reflecting inwardly, focusing more on memories, personal thoughts, or spiritual matters rather than the outside world. This inward shift is often described as a natural preparation for life's closure. Some may even communicate less verbally, using body language, simple phrases, or gestures instead. Medical conditions also play a role. Pain, discomfort, or medication side effects can reduce a person's willingness to interact. Similarly, mobility challenges may make it difficult for them to join activities, leading to feelings of isolation. Over time, this creates a cycle. Less participation results in fewer visits or conversations, which further deepens their withdrawal. For families, it is essential to approach this stage with patience and compassion. Instead of forcing social interaction, offering gentle presence can be more comforting. Sitting quietly beside them, holding their hand, reading aloud, or simply being in the same room may provide a sense of connection without overwhelming them. Respecting their need for solitude while still offering love and companionship strikes the right balance. Ultimately, withdrawal from social activities is not a rejection of loved ones but a sign that the individual is turning inward, conserving energy, and preparing emotionally and spiritually for the final stages of life. By understanding this shift, families can let go of expectations for active engagement and instead focus on offering comfort, reassurance, and unconditional love during this delicate period. One of the most common and noticeable changes in elderly individuals who may be in their final year of life is a significant increase in fatigue and a tendency to spend more time sleeping. While some tiredness is a normal part of aging, this type of fatigue goes beyond ordinary weariness. It is persistent, overwhelming, and often leaves the person with little to no energy for activities they once enjoyed. Families may notice their loved one spending large parts of the day resting in bed or dozing in a chair, sometimes sleeping more than 16 to 18 hours daily. This increased need for rest is primarily due to the body's declining ability to generate energy. As organs such as the heart, lungs, and kidneys lose efficiency, less oxygen and fewer nutrients are delivered throughout the body. This results in a constant sense of exhaustion, even after minimal exertion. For example, walking across a room, eating a meal, or even holding a short conversation may leave the person drained and in need of more rest. Medical conditions like heart disease, lung disorders, advanced cancers, or chronic infections often accelerate this fatigue. In addition, certain medications, reduced food intake, and dehydration can all contribute to lower energy levels. The body, in essence, begins to conserve its limited resources by prioritizing essential functions and shutting down non-essential activity, hence the growing need for sleep. Emotionally and socially, this change can be difficult for families to accept. A once active person may seem distant or unresponsive, preferring rest over interaction. This withdrawal is not necessarily a rejection of loved ones but rather a natural progression of the body slowing down. Caregivers should understand that the elderly person is not simply being lazy but truly lacks the physical energy to stay awake and alert for long periods. During this stage, comfort becomes more important than pushing for activity. Creating a calm, supportive environment, ensuring a comfortable resting place, and adjusting daily routines around their sleep patterns can make life easier. When the person is awake, meaningful engagement, such as gentle conversation, listening to music, or holding hands, can help strengthen emotional bonds without overwhelming them. Ultimately, increased fatigue and longer sleeping hours are not just signs of aging but indicators that the body is gradually preparing for its final transition. Recognizing this allows families to shift their focus from productivity and routines toward presence, comfort, and cherishing the precious moments that remain. A noticeable loss of appetite is another subtle yet powerful sign that an elderly person may be approaching their final year of life. Unlike the normal fluctuations in hunger that anyone might experience, this type of reduced appetite is more persistent and often tied to the body's declining need for energy. As vital organs begin to slow down, the body naturally requires less fuel, and the desire to eat gradually fades away. Families may observe that their loved one eats only a few bites at each meal, pushes food around the plate, or refuses entire meals altogether. Even once favorite dishes may no longer appeal to them. This lack of interest in food often extends to liquids as well, leading to reduced water intake and increasing the risk of dehydration. Such changes can be alarming, especially for caregivers who equate eating with strength and survival. Medically, several reasons contribute to appetite loss in elderly individuals nearing the end of life. Digestive efficiency declines, meaning the stomach empties more slowly, creating a sensation of fullness after very little food. Changes in taste and smell also play a role, making meals less enjoyable. Certain medications can blunt appetite, while conditions such as advanced cancer, heart failure, kidney disease, and liver problems can all alter how the body processes nutrients. Additionally, psychological factors like depression, anxiety, or cognitive decline may further reduce the desire to eat. This symptom is closely linked with weight loss and weakness, as reduced intake deprives the body of essential calories and nutrients. Over time, the individual may become visibly frilier, sleep more often, and rely increasingly on others for care. For families, this stage often brings feelings of helplessness, wanting to encourage eating while realizing the body is gradually shutting down. The best approach is to focus less on forcing meals and more on comfort. Offering small, frequent snacks, high-calorie shakes, or soft foods can help if the person still shows interest. Sometimes, simply allowing a loved one to taste familiar flavors, even in tiny amounts, brings them joy. Respecting their wishes and prioritizing dignity is more important than strict nutritional goals at this stage. Ultimately, loss of appetite is not just about food, it's the body's way of signaling its natural transition. Recognizing and accepting this sign helps families shift their focus toward emotional connection, meaningful conversations, and compassionate care during their loved one's remaining time. Unexplained and rapid weight loss in elderly individuals is one of the most noticeable and concerning signs that may suggest a person is entering their final year of life. Unlike gradual weight changes caused by diet or lifestyle, this type of weight loss occurs without any intentional effort and often cannot be explained by simple factors like reduced appetite alone. Instead, it reflects the body's decreasing ability to maintain normal functions as vital organs slow down and metabolic processes weaken. In many cases, the body begins to lose muscle mass, a condition called sarcopenia, along with fat, which contributes to visible frailty and weakness. Even when an elderly person tries to eat, their body may no longer absorb or utilize nutrients effectively. This malnutrition can accelerate the decline, leaving them more vulnerable to infections, falls, and chronic fatigue. Family members often notice clothing becoming looser, bones appearing more prominent, and an overall reduction in physical strength. Several medical conditions can contribute to rapid weight loss in seniors. Advanced heart disease, chronic lung problems, kidney failure, and especially late-stage cancers are known to trigger wasting of the body. Dementia and Alzheimer's disease may also play a role, as individuals forget to eat, lose interest in food, or have difficulty swallowing. Additionally, medications, changes in taste, and depression can further reduce appetite, compounding the problem. Beyond the physical aspects, sudden weight loss has emotional and psychological effects. Many elderly individuals feel a sense of frustration or even embarrassment as they become more dependent on others. For caregivers, it can be heartbreaking to watch a loved one shrink in size despite their best efforts to encourage eating or provide nourishing meals. Recognizing this warning sign early gives families the chance to consult healthcare professionals about palliative nutrition, supplements, or comfort-focused feeding strategies. While reversing the weight loss may not always be possible, offering favorite foods, small frequent meals, and ensuring a pleasant eating environment can help maintain quality of life. Ultimately, unexplained and rapid weight loss in the elderly is not just a medical symptom but a signal that the body is preparing for its final stages. Instead of focusing only on the numbers on a scale, families should view this change as an opportunity to prioritize comfort, emotional support, and meaningful moments together.